So, brain cancer means a condition in which abnormal cells divide uncontrollably within the brain, distorting the normal brain tissues. So, when we talk about brain cancers, we can divide them into what we call the primary brain cancers and the secondary brain cancers. The primary brain cancers are the ones that originate initially from tissues in the brain. The secondary brain cancers are the ones that are just coming from other areas of the body, like if you had a cancer in the kidney, or you had a cancer in your adrenal gland or the bone, and then it moves and goes to the brain. Those are the second. So I guess what we are talking about right now in this interview is the primary brain cancers, and that start initially from the brain. So yes, they have types, or they can be classified. According to the World Health Organization, and the latest classification was in the year 2020, they have been classified according to the type of tissue that makes the cancer, according to the genetic changes that occur in the cancer, and also according to where the cancer actually occurs. So we can actually simplify this classification into what we call the low grade and the high grade. But under each of these two classifications, there is a whole list of different cancers. The low grade are those ones that grow very slowly and they don't normally move from one area of the brain to another. The high grade are the ones that grow very fast, they are aggressive, and they easily move from one area of the brain to other areas like the spine. So among the simple classification that I have given of the low grade and the high grade are the most dangerous ones. They are the ones that grow very fast, and they can actually grow within a period of just a month and move from one area of the body to another. But also, more specifically, there is a particular cancer called medulloblastoma. It's also a high-grade cancer. It occurs in the posterior part of the brain, and it's the commonest, most aggressive, or most malignant cancer in children worldwide. So, when we are talking about the primary brain cancers, and especially in children, we don't have currently preventative means. So we can't control or stop somebody or prevent someone from getting a primary brain cancer because there are no identifiable external causes of these brain cancers. Okay, so we cannot control them. So that's all I'd like to let people know, that brain cancers are very treatable and they can actually be curable. Okay, it only depends on the type of cancer that it is, and also at what point the patient presents. What do I mean? There are certain types of cancers. When we had actually initially talked about them, we talked about the low grade and the high grade. Now, among the high grade, the chances of cure, okay, are lower. The cure of a brain cancer will depend on the type of the cancer and also at the point when the patient presents. So among the highly curable brain cancers, we have the low-grade cancers. The low-grade includes the grade 1 and grade 2, like the pilocytic astrocytomas, the oligodendrogliomas, grade 2s, all astrocytomas, grade 2s, but also gangliogliomas, okay? But also when we look at the more aggressive type, like the medulloblastomas, there are subtypes, like the WIN subtype, that has a 95% cure rate or survival rate. Now, when we talk about the ones that are more difficult to cure, okay, we talk about the more aggressive or the high grade, like the medulloblastomas. Even under the medulloblastomas, we have particular subtypes, like the group 3 and group 4. Those ones have a lesser survival, like 25 to 35% over 100 survival rate. So those ones are less curable. But also there's a particular cancer called the glioblastoma multiforme. It's a grade 4 glioma. That one really has a very poor prognosis. The cure rate is less than 25%, okay? So most of those patients will die within a period of 5 years. Now, when we talk about at what point the patient presents, if the patient came in and the cancer had just started in its initial stages and it is a small tumor, okay, or a small mass, then it's easy to be able to remove the mass through operation. However, if the patient comes in and the cancer has grown and it's a very big mass extending into different areas of the brain, it may be difficult to operate and remove the entire mass. And if you're not able to remove the whole tumor, then it's unlikely that you're able to cure that patient. When we consider brain cancers in children, the children who are most or who have an increased risk of getting brain cancers are one, children who have certain syndromic conditions. When we talk about syndromic conditions, there are certain children who are born with some abnormalities because of some genetic changes that occurred as they were still in utero, okay, or that's before they were born. So when they are born, they manifest some physical features, okay, that you can see to show that the child is not normal, okay, like the ears may be losses, the eyes, may look in a certain way, but also the heart usually has a problem. So children like that may be at an increased risk of getting cancer, and there are particular syndromes like neurofibromatosis type 1, neurofibromatosis type 2. These ones increase the risk of children getting cancers, particular types of cancers. Then also children who are born in certain families where there is a family history of certain types of cancers are also at an increased risk of getting brain cancer. So if you're born in a family where there is a family history of breast cancer, of pancreatic cancer, of cancers like leukemias, of bone cancers, these cancers tend to move within the same group, okay? So we call it a family of cancers. A child born in that family is also at an increased risk of getting brain cancer. So the signs and symptoms of brain cancers in children depend on the age. We classify them into the infants and the non-infants. Infants generally are children from birth to up to 1 year of age. And then the non-infants are the ones above 1 year of age. So the children below 1 year of age most times are not able to talk and are not able to express themselves. So they will not say certain things, but there are things that you can see. When a child is below 1 year of age, one of the symptoms they may show is what we call irritability. And this is manifested through things like increased crying. Okay? So the child will just cry, endlessly all the time, and you're not sure why the baby is not keeping quiet. That could be one of the symptoms you can see to think of a brain cancer. Also, they show what we call increased enlargement of the head. Because the bones in these children are not yet fused, the bones in the brain. So as the cancer is growing in the brain, the pressure increases. When the pressure increases, the head becomes bigger. And because the bones have not joined, the head can actually be able to enlarge as much as the pressure below 1 year of age. And then also, they can show what we call regression of milestones, meaning that if a child was able to walk, had started walking, or had started crawling, you will notice that now they stop doing what they were doing before. If they were walking, they stop walking. If they were crawling, they stop crawling. They move backwards in their attainment of the milestones. So their growth moves backwards. Okay? And then also failure to feed, like if it's a breastfeeding child, the child may fail to breastfeed generally because it's too weak, okay? And also vomiting. And this vomiting usually occurs early in the morning, and it's a vomiting under pressure. So we call it projectile vomiting. The school-going children, Katasi transfer in school usually present with problems in memory, so they start to forget things. And teachers will also notice that the concentration of the child has reduced in class, the child is forgetting things, the child starts dropping their pen randomly because they can't hold the pen very well, okay? So the learning becomes disturbed towards the child.